Welcome to the Mayo Clinic. My name is Talene. I'm one of the residents here, and just as if you were here for your regular interview, we want to just take you on a tour to see what we have around on campus and what it's like to be a resident here. So right now we are in the downtown campus. So if you were here for a regular interview day, this is pretty much where your day would start. It's one of our two campuses here in Rochester, the other one being St. Mary's, where we will take you here in a little bit. As you can see, our downtown campus is all centered around this kind of nice grassy lawn, which is a really nice place to take a lunch break or a coffee break when the weather's nice in the spring and you're downtown for whatever reason. The buildings we have down here are going to be mostly your clinic buildings, administrative offices, labs, there's the medical school building, and other types of things like that. Methodist Hospital is also right here, and we will take you there shortly. If you were here for a regular tour day, you would hear a lot about Mayo Clinic history and probably get a lot of written information. Since you are not, I can kind of give you the rundown about how the Mayo Clinic came to be and why it is in Rochester, Minnesota, which may be a place unknown to many people. So the Mayo Clinic was started by the Mayo family, as you might infer from the name. So there was the father, William Worrell Mayo, and his two sons, Will and Charlie. They were all physicians and ended up settling here in Rochester and had a little family practice right here in downtown Rochester, which is where we are now. Then in the 1800s, there was this big tornado that caused a lot of death and destruction in the city. And the Mayo brothers and the Mayo father all helped take care of victims from that tornado. After that, there was a Catholic order of nuns, the Sisters of St. Francis, who also had a convent and did work here in Rochester. They had all worked together with the Mayo family during the tornado and approached them and said that the Order of St. Francis would build a hospital here in Rochester if the Mayo family would help staff it and get it going. So that is how the Mayo Clinic came to be, and the first building that was built was St. Mary's Hospital, which we will take you to here in a little while. One of the things that's pretty cool about Mayo is that you have a really nice mix of old and new. So as you can see downtown here, you have these nice new buildings that were built clearly later and have a different style of architecture than the sort of older buildings that you'll see. And so it is just a cool place because, the history is sort of embedded in the culture here, and that really comes across when you're a patient and also when you're a staff. The other thing I want you to note, and we'll pan here in a moment, this is downtown Rochester. So you can see how the Mayo Clinic is really integrated into the city. Rochester was really built around Mayo. What that means is it's a really, really convenient place to be a patient because they're just steps away from hotels, restaurants, to the hospital and clinic building. So patients can very easily get from their hotel to their clinic visit and then out to lunch. It's pretty nice for you as a staff as well. Everything is very convenient. It's very easy for you to get from work to meet a friend for lunch or whatever it may be. So overall, Rochester is just a very convenient place to be, and the structure of Mayo and how the city's built around it all helps breed that. This building you're seeing right now is the Plummer Building. So this would be, if you were here in person, would be a highlight of the tour. This was built by, named after Dr. Henry Plummer, who was one of the founding fathers here at the Mayo Clinic. He was a pretty brilliant doctor. He was one of the leaders in understanding thyroid disease and goiter. He made one of the first linked medical record systems ever. He developed a pneumatic tube system to transport medications all across the clinic. A very brilliant guy. So now what you're going to see are the doors of the Plummer Building. These are beautiful 16-foot bronze doors, and you can't see it here, but they actually depict different historic events, and they have been updated throughout the years. The doors are always open unless there is a national tragedy, so that is just kind of a nice symbolic thing. We are now walking up the steps and inside of the Plummer Building, and right ahead of you is a portrait of the Mayo brothers. This is Dr. Will and Dr. Charlie Mayo. I feel like I would be remiss if I took you on a tour here and you did not get to see who the Mayo brothers are. So there you go. You can see the Plummer Building is a pretty impressive place, lots of marble, high ceilings. It's just a really nice place to come take a breath and, breathe in the history of Mayo. Now, right now we are about to go inside of the elevator of the Plummer Building and up to the 12th floor. So there's two highlights in the Plummer Building. One is there's actually a history of medicine museum on the 3rd floor of Plummer that has history of Mayo, a lot of artifacts, documents, things like that, and also the history of medicine in general. It is closed due to COVID, so instead I'm taking you to the other big highlight here in the Plumber building, which is the Plumber Library on the 12th floor, and we are walking in there right now. This is the main reading room in the Plumber Library. This is personally one of my favorite spots on campus to, get some work done, get some studying done, because it's just a very beautiful place, has a very nice ambiance. You can see there are tons of computers, little reading nooks, things like that. One of the things I want to highlight while we're at the Plumber Library is that this is just one of the many libraries we have here on campus, both downtown and over at St. Mary's. One of the benefits you get by being a resident here is that you have access to Mayo Clinic's robust library services. So for example, there are master's level librarians here at Mayo that can help you out with things like literature searches for, publications or presentations. You have access to basically every article you could possibly need on our online system, and if not, a Mayo librarian can get you to it pretty quick. All right, we are now just a few steps across the way from the Plumber building in the lobby of the Gonda building. So the main clinic buildings for outpatient clinics here are Gonda building and Mayo building. And they're connected. So right now we're in what's called the Gonda atrium, which is the lobby of the Gonda building. And this is kind of the central hub for all the downtown clinic buildings. One of the things I'm trying to point out to you here is you can see there's the big, beautiful windows, so there's lots of light. And then one of my favorite things is that there's just a lot of art all over the place. There's random Warhols. In a moment, you'll see the Man of Freedom statue, which is one of the kind of the center of the Gonda building. It just makes it a really nice place to be a patient and then also to be a staff. This is the piano in the lobby of Gonda, and there are kind of random pianos interspersed around Mayo. There are almost always like a patient or a performer playing the piano here. I've seen choir groups, dance groups. Sometimes they'll have little festivals in these lobbies. All really because Mayo tries to keep everything very patient-centered and make it a nice place to come for care, especially because many of our patients do come here for longer periods of time. Then as staff, we kind of reap some of those benefits and get to enjoy all those nice things that are done for patients. So what are the reasons you would be here in this building are going to be to go to clinic, and I will take you up to the clinic spaces here shortly, but also for education. So I'm sure you've heard much about our Friday simulation curriculum, and we will take you over to the Sim Center, but our other main education day is Mondays. So on Monday mornings, we have our M&M conference, and that takes place at St. Mary's, and then in the evenings, we come right here to the David Geffen Auditorium in the Gonda building for our Chief Conference. The way our Chief Conference works is that we always start with a presentation by a junior resident on like a basic science topic or an ABSITE review type of topic. Then our senior residents, PGY 3 through 5s, 2 residents per session will go with a faculty moderator and do board style question and answer. And this is a really awesome way to learn, both for the examinee and the rest of the people in the audience, because we always do a debriefing at the end to learn about what went well and what could be improved. So you get used to kind of board style situations very early on. And it's a very interesting way to learn the material. Then there will be a staff talk and also part of our new ABSITE review curriculum. There's also associated score modules that we do in advance of each conference to make sure we're on track. Okay, we are now going to go in the elevator here in the Gonda building, and I'm going to take you up to the 12th floor of the Mayo building. And this is our general surgery, our main general surgery clinic area. What I want you to see here is that the Gonda building and the Mayo buildings are connected. So you can see Gonda's to the left, Mayo's to the right. This is the patient waiting area space, so you're seeing things from the patient side right now. You can see the clinic buildings just like down in the lobby. Lots of big windows, art. It's just a very nice place to be a patient and to be a staff. We are now walking over to the Mayo building. So this is Mayo 12. To the left, we're going to have our clinic spaces, and then to the right, just around the corner where we'll go in a moment, is going to be our Department of Surgery offices. So here in the Department of Surgery, if you were here for your interview day, this would be kind of your home base. Our education program coordinators, Joni, Teresa, and Angie have their offices here. And then back through those doors, there are a myriad of faculty offices where many of our general surgery faculty have their office spaces. Our department chair, Dr. Michael Kendrick, also has his office here. The next place I'm going to take you in a second is just steps away and is one of our many general surgery workrooms. So this is on Mayo 12, just around the corner from the Department of Surgery offices and the clinic offices. And it's really just a workroom for residents. As you can see, it's badge access only, so random people are not, going in and out of this. And it's a great place because it's steps away from clinics, so you can quickly get your notes done, dictations done, whatever you need. It's also a nice place to go and study. If you have some extra downtime or need to get some research done. The walls of this workroom are lined with photos of our past trainees, so it's kind of nice to look back on history and see who came before you. Okay, so we are now in one of our very typical clinic spaces. Again, our clinics, this is just around the corner from the workroom where we were just before. Now, when we're on our elective services, so our consultant-based services, the way it works with clinic is that we follow our staff. So the staff here operate on either orange or blue days, which essentially just means that they are in the OR every other day and then clinic every other day. So when you're on an outpatient, an elective consultant-based service, you follow that staff schedule. For us as residents, that means that we get a very balanced experience between clinic and the operating rooms, which is very nice. Here you're going to see just a typical clinic room. They're very spacious, very nice rooms. They all have these big couches, which is nice when patients come with a lot of family members. The other thing that's kind of cool about our clinics here is that each faculty has their own nursing staff that is able to help follow up with the patients and keep, care coordination and all of that going even when we're not in clinic on those days. Here you can see there's also physician workrooms for physicians and staff to just get notes done and all that quickly in between clinic patients. All right, we are now just going a few steps, so like a 2-minute walk from where we just were to Rochester Methodist Hospital, which is one of our 2 hospitals. Methodist is a newer hospital, with the other one being St. Mary's. Methodist is an 800-bed facility, and one of the main differences between this and St. Mary's is that there is no emergency department here at Methodist. So the services that we come here for are going to be colorectal, transplant, breast, elective general surgery services, some of our endocrine, and some of our hepatobiliary surgery services. Where I'm about to take you now, when these doors open, is we're going to be walking into what's called the Skyway. So what this is basically like a covered bridge that goes across streets here and connects buildings. The reason I want to show you this is that I'm taking you right now from the clinic building where we just were to Methodist Hospital, to a patient care floor, so that you can see that, you actually are not going to be walking around outside. So if anyone is concerned about walking around outside in your suit during the Minnesota winters, you will really not be doing that. You can get pretty much wherever you need to be here indoors. We are now here in one of our 2 main staff cafeterias. So this is the Methodist Cafeteria. The way it works here is that we do get money that is uploaded onto our badges by the program, and it's correlates with the amount of call we take. So the amount of money varies a little bit from year to year, but overall I would say it's generally plenty of money. Many of us residents actually end up having a little extra money at the end of the year. Some people run out a little bit earlier, but overall pretty much you will be fed and you shouldn't really be paying for food out of pocket with the amount of money the program gives you. All right, we are now here in Methodist Hospital on a typical patient care floor. As you can see, a lot of this is newly renovated, which is really nice. At Methodist, it's all private rooms. As I mentioned before, there's no emergency department here, so this is all going to be, for the most part, elective surgeries. We do have an emergency general surgery service here to see consults. There is a robust obstetrics and gynecology practice here and a big oncology practice here, so sometimes we get consulted for those patients, but you won't be going to the ER here to see patients. The nursing staff here also are very experienced in dealing with specific types of surgeries because the patients tend to go to those specific floors, so they end up being a really amazing resource for you, especially when you start out here as an intern. All right. We are now here in the operating rooms at Methodist. Methodist has 37 operating rooms, and the part we're in right now is called the Jacobsen Extension. So these operating rooms are actually new. They were built in late or opened up in late 2017. When I was an intern starting in 2018, they had only just recently opened. And the thing that's really awesome about them is they're, besides the fact that they're new and beautiful, is that almost all of them are robotic capability. So this is here in the Jacobsen Extension at Methodist is where we do a lot of our robotic cases. As you can see here, very spacious, fit the robot, can fit a large team, whatever you need to do. For those of you who might be interested in robotic surgery or minimally invasive surgery, I would say that our experience here is very robust. We have a whole robotic surgery curriculum that you can actually start doing when you're an intern. So where I'm taking you right now is into see our robotic trainer. So this is one of the 2 robotic training areas we have at St. Mary's, and there is a self-guided curriculum that you're able to start as early as intern year. Many of our residents do get robotic certification if that is something you're interested in, and we have robotic rotation starting as early as PGY2. This is one of, I'm taking you into just a typical conference room here in one of our clinic buildings. And the reason I'm showing you this is just to highlight that in addition to our regular education curriculum, you're also going to get specialty specific education with journal clubs and conferences for the individual departments or divisions when you're on those services. So it's a great way to keep up with the material within different fields as another adjunct to our education. All right, so we have now gone back downstairs into the lobby of Gonda, and we are in what is called the subway system. So the subway here at Mayo, it is not a train, as many people, including myself, may have thought when they first heard about it. It's actually a series of tunnels that connects all of the buildings downtown. But calling them tunnels is almost a disservice because they're not like dark, dingy tunnels. They are this. They're really beautiful. A lot of areas have like shops and restaurants or just look like a nice hotel lobby, and they can get you wherever you need to go downtown. They also connect to a lot of the hotels and restaurants in the area. So patients are able to actually get directly from their hotels to the clinic without having to go outside. The only places that the subway do not connect are between the St. Mary's campus and the downtown campus, and there is a shuttle bus for that leaves every 10-15 minutes, very quick. And if for whatever reason you end up after hours at either campus and don't have your car there, the security can take you for free at any time, and that's also pretty quick. All right, so we are still downtown, but now we are in the Stabile building. So this is our simulation center. And when you come here for your tour in person, this will be kind of a home base. So this is where we have our Friday intern education curriculums. This is the task trainer room. As you can see, I just badged in here, and we have 24-hour, 7-day-a-week access to this room. This is a Saturday afternoon when I'm badging in here, so you can get here anytime. Within this room, we have multiple laparoscopic simulators, endoscopic simulators, and here in a moment, I'm going to show you this cool thing, which is our vending machine. So this is a vending machine that's full of surgical supplies and simulation models, and you actually can scan your badge here, take out whatever you need, take it home for a couple days, use it, and then return it like a library book. It's pretty awesome. Here we have some of our interns, and they are at a typical Friday curriculum practicing some laparoscopic skills. These laparoscopic trainers normally are in the task room, so you have 24/7 access to these to practice for surgical Olympics, your FLS exams, whatever you want. Our Friday intern curriculum is one of the, personally, I think, most awesome things about our program. It is protected time on Friday mornings for interns to come each week and practice different skills. This is our conference room at Stabile that's set up for a pretty typical simulation session, so you can see hands-on models. It's all hands-on practice, and there are frequently faculty from different subdivisions who will come in and maybe teach you something specific for each day. There's always a theme for the simulation curriculum. All right, so we are now taking a short drive, just about a mile down the road, to St. Mary's Hospital. So St. Mary's is the older of the 2 hospitals. This was that first hospital built in the 1800s. And as you can see from the outside, it has that kind of old, beautiful look and really does retain visually some of that Mayo heritage. St. Mary's is a 1,300 bed facility. It is a level 1 trauma center, and it houses our emergency department. So this is where we have our emergency general surgery services, including our chief service or the hospital surgical service, our surgical ICU, and you'll do your trauma rotations here. One thing I want to point out though about St. Mary's is that even though it is an older building, it's not many parts of the hospital are actually newly renovated, so it is quite beautiful. It doesn't really have that old, dingy hospital type of feel. Right now we're in the subway at St. Mary's, and you can see just like downtown at Methodist, really beautiful, lots of art and things like that. But then interspersed with all that new, we keep some of the Mayo heritage. So these you can see are the Sisters of St. Francis, some of the founders of the Mayo Clinic. So it is just a cool place to have that history juxtaposed. All right, so we are now on the first floor of St. Mary's in our operating room. So this is our general surgery hallway, all the way you can see. There are 70 operating rooms here at St. Mary's, and they are quite busy. We have a very high volume surgical practice here. One of the things I'm showing you is that the staff names on the individual OR door cards, because on our consultant-based services, another pretty cool thing is that each of the staff have their own OR crews. So nurses, techs, surgical assistants who are able, when you're a resident on that service, to actually teach you, and you learn just as much from them as your staff, I would say. All right, for anyone who is interested in pediatric surgery, right now we are in our new pediatric atrium in our children's hospital here. We do not have a freestanding children's hospital, but it is attached to St. Mary's, and actually they just had brand new operating rooms built here that opened just this past spring, in addition to that children's atrium you just saw. Right now we are in our pediatric PACU that is directly connected to our operating rooms, where I'll take you here in a bit. So you can see it's all brand new and pretty nice. The peds surgery rotation, I would say here, is very robust. We do not have a pediatric surgery fellowship here, but what that means for you is that you are operating one-on-one with the staff as early as PGY2. We rotate through peds as a PGY 1, 2, and 3. And so that means that starting as a 2, you're one of the seniors on the service. So I would say that pediatric surgery is one of our best learning experiences here, and one of our rotations where you learn the most operatively early on. We are now going into one of our pediatric operating rooms, and you can see this is our emergency peds OR. And as you can see, they're beautiful, large, newly renovated. Very typical of Mayo is that all of our ORs have like a resident computer area where you can get your notes and stuff, orders done right after the case, even while the patient is waking up, which is very nice. We are a level 1 pediatric trauma center as well, so you will get experience with pediatric trauma when you're on your regular trauma rotation and when you're on the peds rotation. And there is actually an elevator that takes you right up from the peds trauma bay to these ORs, which is pretty nice. We do also have the opportunity to go to St. Paul for a pediatric surgery rotation in our 3rd year, which is a favorite of many people. It gives you the opportunity to work with different surgeons, see a different type of environment, and also, live in Minneapolis, St. Paul for a few weeks, which a lot of people get to take advantage of and enjoy. All right, we are now in our emergency department here at St. Mary's, and this is one of our trauma bays. So we are a level 1 trauma center here. I will say that we, are primarily blunt trauma, so it's not the knife and gun club that some of you may be used to, but we are a very busy trauma center. You will do trauma as an intern, PGY 2, 3, possibly 4, and I would say that I don't know anyone who's had any issues actually meeting their trauma number requirements. We do get plenty of operative trauma as well. Here what I'm showing you is our Mayo 1 helicopter. And the reason I am showing you this is to say that in addition to our local population, we actually get a lot of referrals both for traumas and emergency general surgery or critical care patients that come from all over Minnesota, but also the surrounding states. Right now, we are in our surgical ICU, Mary Bryce 7B, which is our trauma and emergency general surgery ICU that we staff. So this is where we get a lot of our sick patients come up after trauma or after operation. We rotate through the SICU as an intern, and then as a PGY2, you're actually one of the seniors here in the unit. So our critical care experience here is very robust, and doing, ICU as a PGY2 is one of the major learning experiences you have. It's a time for clinical growth, and doing that rotation early on really helps you learn, how to recognize and manage a sick patient, so that when you go ahead and you're taking home call, potentially even later in PGY2, you're really prepared and feel more comfortable taking care of sick patients. We also do have a critical care fellowship that you can do after third year if you want, or many people stay and do that after graduation. It's a great experience. It's also a great way for you to get to know staff pretty early on in your career and recognize an interest in critical care if that is something that interests you. And also, as you can see, these are our typical ICU rooms. They all have kind of a big window, which is nice for the patients and the staff. Okay, so now we are still on the 7th floor at St. Mary's. I'm taking you to see some of the amenities we have for residents here. So that was one of our typical resident lounges. We are now going to see our call room areas. So one of the things that's nice here is that there are multiple areas with call rooms, and I would say there's ample available call rooms. This is a pretty typical call room here at Mayo, but maybe not so typical in call rooms in general. It's pretty nice, pretty large. There's always clean linens and scrubs available. So that's pretty nice if you've had a long day. You can take a nap if you're on call, whatever it is. Sometimes even a nice place to get work done. There are also several of these resident lounges you can see here where they have, drinks, snacks, some sandwiches and salads available in the fridge for you 24/7. And this is just an example of one of the many ways Mayo tries to take care of residents. So, if you're working late and you miss cafeteria hours, there's always some place you can go and grab something to eat, especially if you're on call. So that's all pretty nice. The other thing that's nice is that in addition to, specialty specific call rooms that, you can maybe be assigned when you're on a service, there's also quite a lot of unassigned call rooms that you can, drop by or sign up for online. All right, so right now we're in one of our many workrooms. The way that workrooms work here is that each division or department has their own workrooms. So this is the vascular workroom, for example, but there is also a general surgery workroom just for residents that you have access to whenever you want as well. All right, we are now in the library here at St. Mary's and Marion Hall. This is another one of my favorite spots here at St. Mary's because it's just a nice place to get some studying done, research done, whatever you want to do. What you can't tell from this video is that this is actually right below the call rooms that I just showed you. So if you're on call and you want to get some work done but don't want to be in a call room, that's another place that you have badge access to whenever you'd like. Here we're just taking a walk through the subway at St. Mary's. This is a little Starbucks cafe where you can also use your badge. There's actually 2 Starbuckses now, which is pretty nice. And again, you can use the meal money that the program gives you, so you don't have to worry about paying out of pocket for your snacks and stuff while you're on call. All right, so if you were here in person for your interview, this is probably where you would be for your pre-interview dinner here in downtown Rochester. I'm going to pan over here and show you this tall building you're about to see is the Plummer Building. So this is again just to show you that everything in Rochester is pretty close and that the Mayo campus is really integrated with the downtown. This is one of the highlights of, usually one of the highlights of our tour, which is the Dan Abraham Center for Healthy Living, aka the Mayo Gym. And this is a newly built, beautiful gym, fitness facility here that as Mayo employees, we have access to at a discounted rate. So it starts at about $30 a month that can come right out of your paycheck, but then it actually ends up being less if you use it pretty frequently, so pretty affordable. They have a really robust class schedule, which is amazing, and they also have a satellite gym at St. Mary's that you get 24/7 access to. So if you're on call or before or after work and you want to get a workout in, very easy. All right, so now I'm going to take you around just to some places in Rochester so you can see what it's like. So this is the golf course at the Rochester Country Club where they actually have a pretty hefty resident discount. So there's a lot of us are members here if you like golf or other outdoor activities. But I'm trying to show you that if you like being outside, you like doing things in nature, then Rochester is a pretty awesome place for you. There are tons of parks, walking trails, places if you have kids to be outside with family. that you can all do here. The other thing is that Minnesota in general is a very beautiful place, pretty awesome place if you're outdoorsy. You know, just within 30 minutes to an hour drive, there are major lakes, biking trails, hiking trails, places to get away for a day or a weekend, whatever you want. Also, if you are maybe interested in things like restaurants, shows, things like that, you are more of a city person, we are just about an hour and 15 minutes drive from Minneapolis and St. Paul, which is a pretty awesome city. They have a very robust restaurant scene, and they also have the Minneapolis-St. Paul airport, which is super convenient and easy to get to. All right, well, thank